Good evening. This is Case Study 1, Hospital Implements New Minimum Necessary Policies for Telephone Messages. I am Jessica Sprague, and I am a jury for the case. At this time, I would like to bring into question the validity of this case under review for the following reasons. 1. As Mr. Hyland for the defense pointed out, the conversation between Jacob Jones' daughter and Beverly, the employee of St. Ashford Hospital, was not recorded, so the extent of the conversation is unable to be verified and therefore is considered hearsay. 2. The statute of limitations has been exceeded. The plaintiff had a maximum time frame of 4 years to file his complaint, and thus the claim has exceeded that time frame by 13 years since the occurrence of the declared violation of privacy occurred in 2001 as stated by Mr. Hyland. Third, both parties have failed to provide sufficient evidence for a decision to be made in favor of either party. Evidentiary support regarding the written consent or lack thereof was not provided, proving that either the patient did or did not consent in writing to the disclosure of his medical information to his daughter. Additionally, no verified documentation was provided, proving that his daughter was present at the time of his doctor's appointments. Again, the conversation between the plaintiff's daughter and the defendant's employee, Beverly, cannot be verified since it was not recorded, nor was there a witness to either party. In addition, the implication of breaching confidentiality determined by the review board that performed the OCR investigation did not result in disciplinary action, so we must assume the investigation was inconclusive of any wrongdoing on the part of Beverly. Finally, it was also not made clear if the information disclosed was released to prevent harm to the patient or someone else. I would like to request that the judge provide further instruction at this time based on the aforementioned conclusions. However, if I must render an opinion at this time based solely on the presented evidence, I would have to vote not guilty due to lack of evidence. There was no written consent allowing the defendant, St. Ashford Hospital, to impart private medical information to anyone other than the patient himself, and this is a direct violation of HIPAA regulation, which states no agency shall disclose any record which is contained in a system of records by any means of communication to any person or to any other agency except pursuant to a written request by or with the prior written consent of the individual to whom the record pertains, unless disclosure of the record would be for law enforcement purposes, congressional investigations, and the Department of Homeland Security. In addition, certain states also have equivalent status. This was quoted from the Privacy Act of 1974. Additionally, the American Medical Association's ethical principles also state the patient has the right to confidentiality. The physician should not reveal confidential communications or information without the consent of the patient unless provided for by law or by the need to protect the welfare of the individual or the public interest. This is not limited, however, to physicians and does include all medical personnel. Privacy and confidentiality are very important to every patient as well as to every medical professional. Though closely related in distinction between privacy and confidentiality is an important one. In the context of healthcare, privacy is a right of patients to control access to their person and information, whereas confidentiality is an obligation of healthcare providers to keep their patients' information secret. It is my determination that St. Ashford Hospital and Beverly failed to ensure both patients' privacy and confidentiality by first not receiving the consent to disclose information in writing to the patient's daughter, and second by disclosing the information without consent. However, I do not believe that it was with malice or intent that the information was released to the patient's daughter for the purpose of causing outrage, mental suffering, shame, or humiliation to the patient. Finally, under certain circumstances, information can be released in order to prevent harm to the patient or someone else. Since after several attempts to reach the patient had failed, it seems that it was with prudence that Beverly released the information to the patient's next of kin, his daughter, in order to prevent additional harm to the patient due to his medical condition. St. Ashford Hospital and Beverly are not guilty of intentional wrongdoing in this case. not guilty due to lack of evidence, and not guilty due to exceeding the statute of limitations for reporting a violation of privacy and confidentiality.